Welcome to Hardemil Dental Clinic. My name is Christian Mehl, and with this small presentation we show you how we elevate the sinus in the upper jaw to ensure implant stability. You can see here the initial situation of a patient who came to our practice wearing two dentures, one in the upper jaw, one in the lower jaw, being fixed with telescopic crowns. You can see here the white bits are the frameworks and the telescopic crowns on top of the teeth, and the patient wanted to have nice fixed teeth. And in order to do that, we needed to place implants. But you can see here, indicated by a small blue arrow, that the distance between the top of the bone and the sinus, the maxillary sinus, is only roughly 4 millimeters. So if we want to place an implant, the implant is around 10 millimeters long. So if we will place it directly in that situation without doing anything, we would directly place the implant into the maxillary sinus, which can cause inflammation and additionally might not be stable. So what we do here, or what we need to do here, is a so-called sinus lift. You can see here one of the canines crowned with a telescopic crown, indicated by the blue arrow just for orientation, and then you can see indicated by the small yellow arrow the so-called sinus. So you drill a hole in the mouth on the lateral wall of the maxillary sinus to gain access to it and to increase the sinus floor, to elevate it. You fill the area with particulated artificial material or material of bovine origin or porcine origin to create new bone. Here you can see the material going into the elevated sinus using an injection of bone of bovine origin. The artificial bone will be covered by the natural membrane of the sinus, which we elevated beforehand. And you can see here the material placed into the elevated sinus. And a lot of studies show that this will be bone within 4 or 5 months. You can see here a membrane of porcine origin, which will cover the entrance. And you can see here on the X-ray, just remember where we before had the 4 millimeters. You can see here now indicated by the yellow arrows where we have lifted the sinus. So now we can place implants of an appropriate length. The material needs approximately 3 to 4 months before it can considered to be bone. The particles which we place, the artificial particles, they will stay there approximately 10 to 15 years before they completely resorbed. And now you can see the placement of the implants into the augmented sinus, and that is now perfectly safe, and we will have to fear no inflammation. Then of course you stitch up the wound. Ask the patient to be very careful. Let the sinus lift heal for 4 months, then place the implants. Let the implants place or heal for another 3 months, and then you can place the final prosthodontic work on top. Thank you very much for your kind attention.